We are now in day 66 of lockdown in South Africa, and thank you to all for joining us. Ladies and gentlemen, COVID-19 is a very serious event in the history of South Africa and the history of many, many people, and across the world it's impacting. You probably know that in the USA, 106,000 people has passed away already, and in South Africa the figures last night was 683. So on that note, I want to say, ladies and gentlemen, thank you for taking the time to join us today. It's the 1st of June 2020, and we're moving into level 3. We've been looking forward to this for a very long time, and we've decided to make time in our diaries to spend an hour with you, to update you and to bring you on board in terms of what is required. So first of all, a hearty welcome to all the participants. I see we're moving towards 70 participants on a Monday morning. Thank you for taking time, and thank you for engaging. We're learning as we go, so a couple of small things just to make it all work. First of all, we are recording everything that happens. So be aware that you are being recorded. The idea is to also take the recording and place it on YouTube with links. So if you fall off during the course of the program, just join again. We're not going to stop the program. The program continues running. Secondly, we have the function to mute everybody, which is what we do. Otherwise, it becomes havoc out there. And then finally, if you have your video on, I suggest you switch it off. I'm looking into some people's offices and all sorts of things. It also helps with the networks. The networks are highly strained this morning across the country. So I suggest you switch your video off. I will also do so in a moment. And then for purposes of communication, it would be nice if you actually rename your Zoom name to your actual name and business so that we can communicate with you afterwards. So if you say you are Henny, say you are Henny Ferreira from ABC Financial Services. So just a couple of practical things. Then, ladies and gentlemen, the presentation, we will be doing some screen sharing. And what I recommend is that you keep your questions for the end. We will be doing the questions only in text. It works better. We did a couple of training sessions and tests last week. But I suggest that you keep your questions towards the end. We will then group those questions together in the interest of time and deal with it on a basis of themes. Just to give you some more background and some brief introduction, the team working with us here today from the MFSA side, we've got Doreen, Kirsten, Sunay, and Johan. They're all in the background, working with us. They're all helping to host and co-host to bring it all together. So also thank you for the team for putting this together on very short notice. Ladies and gentlemen, before I hand over to Dawn Julian, who will be taking you through the hard content, just a couple of general remarks which I think is important to make at this point. At the beginning of the program, of the process of the lockdown, we said we're going to go in with a tango and come out with a very, very slow waltz. That is exactly what's happening. The process will be a slow one, and there is a couple of things that's playing out which I think we just need to say to one another very quickly. Dawn will be talking about the legal stuff today and the compliance imperatives, but there's early signs coming through that clients, first of all, will go and do their business where it is safe. There's retailers who are picking up that people are moving to different shops because the shopping experience is safer. So over and above for the fact that it's a compliance requirement, that's about your own safety and the safety of your staff, it's also about the safety of consumers who wants to be safe. I think the whole discussion around the schools speaks to that. Secondly, I think we just need to be very aware that the transport hubs and the transport processes has changed. And that to me says that good spots and where it's a good place to do business is probably also going to change. So one needs to be very, very astute to that. And then just a final point, if people can work from home, they probably also want to borrow from home, and they will then probably have to be served in a different fashion, remotely or from home. So I think it's important elements to bring into your thinking at a general business level as we speak. I need to share with you, a couple of years ago, Leonie and myself, Leonie's joined us this morning, she's back on her first day from maternity leave. We went to go and visit two guys in the east of Pretoria, two youngsters who ran their business off their laptops, and they traveled the world and they kept on doing their lending. They were light years ahead of their time, but that is how they've run their business. So this all speaks to big changes everywhere, and then certainly also big changes in your place of work. So on that note, ladies and gentlemen, once again, hearty welcome. Thank you for taking the time. Well done on still standing after all we've gone through, and let's start the work to rebuild and to line ourselves up for a better future. On that note, I'm going to hand over to Dawn. Dawn will just set herself up. Dawn is working from Port Elizabeth at the moment. She's locked down there. She has done work in our industry extensively. In fact, she was recommended to us by one of our members. And the MFSA is paying her for her to do the work here today, so you need to know this is a professional relationship. And then she will also at the end share with you her contact details if you wish to engage with her further. So without any further ado, Dawn, thank you for joining us. Let's hope the technology holds up and that we have a fruitful session. Thank you very much.
Thank you, Henny. Can everybody hear me clearly? I hope so. I'm going to be sharing my screen, so it should take a second or two just to come through.
Thank you. You are very clear, Dawn, so the environment is good.
Fantastic. Great. Is it coming through?
It's in, yes, got it.
Okay, fantastic. Right, good morning, everybody. Yes, I think we're living in interesting times at the moment, and I hope everybody is staying safe and, oh, sorry, let's just do that. And yes, keeping the masks on, doing the hand sanitizing things, and, you know, doing all things that we're supposed to be doing. I'm sorry, I seem to be having a little bit of a technical difficulty here. Let me just stop it and try it again. Oops, sorry. Let's just stop my screen sharing. Sorry about that. Okay, let's try again. Okay, there we go, that's a bit better.
Here we go.
Okay, great.
Great. The picture and the sound is great. Thank you, Dawn. You can continue.
Super, thank you. Right, I'm sorry, I'm going to have to just move this across here. I'm working with two screens at the moment, so it doesn't seem to be working so well with the with the screen sharing. But anyway, let's do it manually, and then we will just take it from there. Right, I'm going to be talking about getting back to work this morning. As many businesses have remained closed or partially closed under the lockdown regulations for the past couple of months. Now, we all know that the implications for business and the economy in general have been disastrous. But getting back to work from today does not mean we are getting back to work as usual. The workplace that we knew and the day-to-day life that we've become accustomed to, for the moment doesn't exist, and it's not going to exist for a long time. Do not make the mistake of thinking that because we're now going to get back to work, because we're going to be opening offices, etc., that we're going to back to the way that things were done historically. Okay, we are only starting at this point in time to get into the new regime, the new way of doing things. And this is going to be around for quite some time. Now, if you look at what's come through in terms of the regulations under a lockdown level 3, return to work is allowed for just about 99% of the industries that we're seeing out there. There are some exceptions, like we've seen, places like shebeens, restaurants, public areas, theatres, etc., are still not open to the public. But for those of us that can, it's great. It means that we can resume business, but it's very important to understand that this must be under a controlled circumstance. And as employers, we must understand what we're dealing with. Now, lockdown for many of us has meant that we've stayed home, we've done the hand sanitizer, we've used face masks when going out, but this is not necessarily what has been happening in the rest of the country. By opening up the industry, we as employers need to understand that we're dealing with a hazard, and we need to manage this hazard and ensure that staff and the general public are properly protected, or at the end of the day, we can be held liable. I'm not sure if you've been watching the news, but there's been 2 different sets of lockdowns that we're dealing with. There's the lockdown that we've seen in some areas where everybody has complied and they've stayed home and stayed safe. And then there are areas where no lockdown has happened whatsoever. People have been going out, they've been treating, this COVID virus as something which doesn't necessarily have to be complied with. And maybe they've not been able to comply with it specifically just because of the nature of where they live and how they live. So COVID has been declared an occupational disease as well as an occupational hazard. So when you're thinking about how you're going to comply with it, what the rules and the regulations are, we need to refer back to the Occupational Health and Safety Act. The requirements for this return to work are found in the legislation, in the regulations, as well as in the regulations which has been set out in the Disaster Management Act and what's been issued by the Department of Labour and various sectoral determinations. Now, there's a whole bunch of stuff. There's a whole bunch of regulation which we need to comply with. I'm not going to be talking about the main measures you should already have in place because of, the health and safety requirements for every business. But as we talk about what you need to do in respect of COVID, please remember that all of the health and safety measures which are supposed to be in place need to be taken into consideration when you implement your plan and when you start going back to work. We're in for the long haul, as I said. The planning part of it is the start. The planning part of it is also the most important part of getting back to work, because if you don't get your planning done properly, you can end up with something that doesn't work. You can end up with a very expensive exercise where you're trying to obtain things which might not necessarily be available, or you might just not know where to start. So every business that's now going back to work has to have a documented workplace plan. This needs to be done and completed before you open your business. There are certain legal requirements that have to be in the plan. It must be documented. It must be available for inspection if anybody comes in and asks for it. But the nice thing about it is that it's got to be appropriate for the size of your business, the nature of your business. Now, although there are certain regulatory requirements or like a list of things that need to be in your workplace plan, the biggest thing that you need to remember is that everything that you are going to be doing or implementing now in respect of getting back to work or resuming work must be risk-based. This whole program, getting back to work, getting our employees going again, opening up business for the general public is probably one of the biggest risks that we're facing at the moment. Our hazards and our risks in terms of exposure so far have been pretty limited. The minute that we open our doors, this virus is going to go mad. And it's up to us as employers to understand what the risks are and to deal with them. And this is where you need to start in respect of your planning to get back to work or managing the process of the new normal. So where to start? Right. The first place to start is now looking at these particular risks. You're going to have to go back to your particular workplace, your areas, your workspaces, whether this be from home, if you have people that are working from there, or from your offices, where you're going to be providing your loans from. And you're going to have to do a very thorough investigation in terms of where the risks lie, where the hazards lie. And this is going to have to be documented. Now, you're going to have to think about all sorts of things in terms of the risks. For example, right, somebody walks in and they might be infected. So the risk is that an infected person walks into your workplace and infects everybody else. It could be because they sneeze, it could be because they cough. So that has now been identified as a risk and a hazard, and you're going to have to take measures to reduce this. There's another risk, for example. What if the person is now applying for a loan and they take out their ID and their hands are not sanitized, and there's stuff that's on their hands that now goes onto the ID card. One of your staff members takes the ID card to copy it, etc., and the virus is now passed on this way. Okay, this is another risk or hazard that you would need to take into consideration. There are more. There's the risk of people not complying with your entrance and exit screening requirements. There's the risk of your staff not taking this seriously and following your rules and regulations. There's the risk of staff not understanding what they need to do. There's risks of staff using the same kitchen utensils and not washing their hands properly afterwards. So it's really, really important that you really sit down and think about everything that could possibly go wrong. Because when you do this getting back to work plan, the idea is to take these risks, analyze them, see where you're exposed, and then put measures in place to deal with them. Part of this analysis of the risk of getting back to business includes identifying special classes of staff. Now, when your people get back to work, it can't be a one-size-fits-all, because there are certain people that are more susceptible or more at risk if they do contract the virus. Your workplace plan must clearly identify these people. So the types of things that you're going to need to look at are, number one, the risk of the person's occupation. Now, there are certain levels of occupational risk which have been published. For example, the risk of somebody who is a health worker working in a hospital would be much higher than somebody who is sitting in an office and doesn't see any people. If you look at the loan environment generally, your employees who are dealing with clients, customers on a day-to-day basis would generally fall into a moderate risk area or zone. Now, for this, there are going to have to be certain measures implemented to protect their safety as well as the safety of the customers. You'll then need to look at high-risk employees. Now, your high-risk employees are persons who, for example, have some sort of underlying health issue like asthma, high blood pressure, heart problems, being HIV positive, any sort of immunodeficient or suppressant issue or symptom or situation. And how are you going to identify these staff? You're going to have to think about this. My suggestion, practically, is that before you now start opening your offices 100% and getting to the get-go, each staff member should complete a questionnaire. You can maybe get their updated details at the same time. And some of the questions that you need to ask or include in this questionnaire are specifically related to the person's health risk. You should also include questions, for example, relating to who the people live with or reside with. For example, if you've got a low-risk employee, okay, healthy, younger person, no underlying issues, etc., but their husband is an ambulance worker who might be in daily contact with people who might be infected, you need to note this as a risk, and you're going to have to put measures in place to deal with this. We've all seen on the news that people who are over the age of 60, some people are saying 65, as you get older, your immune system doesn't work so well, and these people are more at risk, not of contracting the virus, but of developing more severe cases, which are going to lead to hospitalization, etc. And there is now a requirement that for anybody who is high risk, the employer must put in additional measures to make sure that these people are protected. I don't know if any of you have staff who are currently sitting in other provinces that need to move back to work. That is permitted at the moment, and part of your plan should be putting it or making it very clear how you're going to start repatriating these people. The state doesn't want there to be a general exodus. They're really trying to control public transport so that there's not overcrowding. There are limitations at the moment in terms of how many people, for example, are permitted on buses, trains, taxis, etc. So the idea is really to think about how you're going to start bringing your staff back to work in a controlled and a phased way so that we are not going to just flood the market, flood the workplace with all of these people, which will then result in this COVID crisis becoming completely unmanageable. While you're thinking about the risks to your business, and it's not the risks to your business per se, but the risks in your business, to your staff, to the general public, you should be thinking about the risks to your business as well. This crisis is going to have huge implications for all of us. You're going to potentially see staff absenteeism. This could be because people might have children at home that are not going to go back to school yet. It might be that somebody in the house gets sick. It might be as a result of self-quarantine. Or it might just be that people are afraid to come to work. As Henny mentioned before, there's going to be a change in commerce patterns. People will want to go where it's safe. People want to go where they know that there are measures in place to ensure that what they need is going to be there, but they don't have to place themselves at risk because of this. There are potentially going to be interrupted supply patterns. So in other words, you have a requirement for a certain number of face masks. We've already seen that there's a shortage of supply. You're going to need hand sanitizer, cleaning materials, sanitizing materials, face masks. If you don't think about what could potentially go wrong in obtaining these things, you might end up with a problem in the long run. So part of your risk analysis is thinking about these things as well, so that you can put some sort of plan in place, like perhaps your lead times for ordering, finding alternative suppliers. Think about those things, because this is what needs to go into your plan. So every business that's now going to go back to work has to have a compliance officer. The compliance officer should be somebody at the workplace. They should be somebody senior, and they must be trained in what should be done, what to look for, how to monitor, and really how to do the compliance job. Now, their job entails coordinating this whole back to work program. And it's not just back to work, it's going to be back to work and stay at work program. It's their job to make sure that compliance happens in your workplace. Whoever gets appointed must really get to grips with what is required, be able to audit, be able to check, and have the authority to deal with issues where there is non-compliance which has been identified. The details of this person must be posted up somewhere in your workplace. So you're going to have to find a place where you can put a poster up. Maybe you have a notice board, and it can't just be in small, 12-point print. It's got to be visible, it's got to be durable, and it's got to be prominent. Now, how you appoint this compliance officer is entirely up to you. You can appoint a compliance officer per workplace if you have multiple offices. You could perhaps look at a regional manager taking this responsibility. This is one of the flexibilities which we are allowed dependent on the size, the nature of your particular business. The biggest thing, though, is that the person must be able to do the job. If you have more than 10 staff members, you are required to have a workplace health and safety manager appointed as well. Now, the workplace health and safety manager could also be the compliance officer. It's entirely up to you once again. The job of the workplace health and safety manager is to be the intermediary between you and the employees. They need to talk to employees and address their concerns. It's their job to keep staff informed in terms of what's happening in the workplace and staff's health and safety in general. And it's also their job to consult with workplace committees if you should have these in place in your particular job or workplace. So we've spoken about high-risk employees. One of the things that is an option for a high-risk employee is the possibility of working from home. Doesn't only have to apply for high-risk employees either. I mean, you can decide that there are certain jobs or tasks or functions which can be performed from home and agree with your staff members that they will continue working from home in the interim until things become a little more easy to manage. Now, you need to understand that anybody who is working from home currently or who's going to be working from home going forward still falls under the Health and Safety Act. Now, this means that the health and safety measures which you're going to be applying in your normal workplace are also going to apply at home. This could mean home working adaptation. It could mean re-looking at the logistics of where you actually set up your home office. But at the end of the day, what you need to think about is risk. Everything goes back to risk. So if you are, or your employees are, working from home, you're going to have to conduct a risk assessment. Think about things like if you have kids or animals, and there are cables from your laptop going to a plug, which are now a tripping disaster. Somebody comes, falls over the cable, and drops a monitor on their head. If it's one of your employees or it's in the workplace where they are normally, doing their day-to-day job function, it's a health and safety issue and falls under the Health and Safety Act. You're going to have to implement procedures for these persons to work safely, to monitor their environment, to get up every 45 minutes, otherwise there could be issues with back problems, etc. So you're going to have a procedure for this. There's also going to have to be somebody to monitor that these procedures are going to be followed. Now, how you do this is entirely up to you once again. Fortunately, we live in the age of tech. So it's easy enough to send somebody a checklist and say, right, go and check all of these things in your home office environment. Send me a photo of where you're working, and once a week, let's just go and check to see if anything has changed. Now, aside from the procedures that you're going to need for people who are working at home, you're going to have to look at the procedures from working at your normal office or your workplaces. You're going to have to start thinking about whether the way you do things on a day-to-day basis can be changed to try and minimize the risk to you, your clients, and your staff. So one of the things is, online working. There's a huge market out there in terms of people that want loan facilities, that have access to smartphones, that have access to laptops, etc. And really, it is the way going forward. It's convenient, it's cheap, and it's one of the ways that you can really, really start looking at expanding your market. Staggering work times is another way of looking at things going forward. Perhaps you might be introducing different shifts. So I know that some of the retail stores introduced hours, specific for older or compromised clients. So if you wanted to go shopping between 8 and 9 in the morning, if you were a pensioner, the shop was open for you specifically. So you could quite comfortably then go and do your business without being exposed to other people. There are rules and regulations in terms of how many people are going to be allowed in your offices at one particular point in time. Now, dependent on how many staff members you have, you'll either be sending everybody back in one fell swoop, or you might have to stagger and say, right, in phase 1, 50% of our staff will actually return to work. The other 50%, we will decide they will either stay at home, or we'll find some sort of other environment that they can do their job in. Now, where you have less than 100% of your staff members at the workplace, start thinking about employee rotation. Who's going to work when? Are you going to introduce shifts? These are the types of things that are also going to have to go back into your workplace plan and be properly documented. You're going to have to communicate. One of the biggest problems that we see on a day-to-day basis results as a lack of communication. Bad communication, the wrong communication, misinformation, poor information, all of these things lead to chaos. So before you now go and open up everything 100% and allow clients and staff, think about your communication plans and make sure that these are concrete and that you have measures in place, number one, to stay up to date with all the latest information, all the latest requirements, and then clearly communicate these with staff. Your people know what's going on out there, but they need to know what's expected of them in the workplace. They need to know what to do if something goes wrong. They need to know who to speak to if they have any questions. So let's get to the physical aspect of your business. One of the key things that you need to look at in terms of physical structure is the ventilation in your offices. There's a requirement to have proper safe ventilation. This can either be natural ventilation, opening doors and windows, or mechanical, such as air conditioning. If you do have air conditioning, however, or extraction ventilation, you need to make very sure that the filters are changed properly. Install high efficiency air filters if you can. Replace the components when they need to be replaced, because if you don't, this is one of the ways that the virus possibly could be transmitted. We don't know yet because not enough is known about it. Now, if you're going to be, ventilating your offices by having your doors and your windows open, don't forget the safety and the security protocols, because you can't just leave the door open and not expect everybody to start walking in. With the changes, the updates, we're seeing new regulations, new information coming in on a daily basis. Now, what's happening in the workplace is not always what we think is happening. We get fed certain information, but unless we really know what's going on there, we're really running a little blind. Part of your communication plan should be having a proper feedback system so that you know exactly what is happening in each of the offices that's opening. You need to know whether people are following process. You need to know how many people are coming in. You need to know what's going right, and you need to know what's going wrong. You also have to have a communication plan so that where information needs to be fed through to the authorities, for example, if you have a positive COVID case, the authorities would have to be notified. Who's going to be doing this? How are they going to be doing it? And when are they going to be doing it? So these are the types of things that you would need to think about and you would need to include in the plan itself. You're going to have to talk to your public. You're going to have to talk to your customers because they need to know what's expected from them as well. One of the things that we've seen is physical distancing. So when you are going to open the offices and customers are going to start coming in, they need to maintain that distance. How are you going to communicate this with them? How are you going to talk to them when things get a bit too tight or they're a little too close to the person in front of them? There's a number of ways that you can communicate with your staff, with the authorities, and with your clients. And you need to think about what the best way of doing this is. So once you decide who's going to go back to work, you are going to have to issue everybody with a work permit. Now, there's a certain format that the work permit must follow. It's very easy. It's not a difficult document. And the CEO of every business or somebody who he designates can complete this work permit and issue it to all staff. Where staff are going to work, doesn't matter whether they're using their own transport or public transport, they must take their work permit with them. They must also carry their ID with them, because if they get stopped, If anybody gets stopped going to work and you do not have your ID with you, you will be instructed to go home. Interprovincial travel is permitted for people that need to travel, going to work and home again, or for people that need to travel for work. The only thing that you're going to need if there is interprovincial travel for work purposes is the work permit and the person's ID. I suggest that if you have people like this, let them perhaps have 2 copies of their work permit, one that they keep with them and one that they perhaps keep in a vehicle or as a spare. If it does get lost, it's not the end of the world. You can just print another one off and give it through to them. So when you're preparing your workplace, we've thought about the risks that could happen, the hazards. You now need to start preparing to deal with these, to manage these, to mitigate these. Now, the rule is generally that you can have 1 person per 1.5 square meters of your workplace. This means that you're going to have to go and measure each of the offices, see how many square meters it is, divide it by 1.5, and that gives you your answer. Now, it's not enough that you just measure the entire building or the entire office space. You're going to have to go room to room and measure each one of these, because that 1.5 square meters is going to apply to each of these. Think of smaller spaces, for example, like a filing room or a toilet facility, or if you have a kitchen or a kitchenette facility. How are you going to manage this so that there is only 1 person per 1.5 square meters at any one point in time? You can look at measures like putting signage up. You can look at measures I've seen that actually worked quite well with a basket of pegs, and every time somebody went into a particular room, they had to take a peg. And when there were no more pegs, you knew that there were now enough people in that particular room and nobody else could enter it until somebody had come out. Look at closing off areas that might be problematic. I don't know if any of you have a canteen area or a small space which you can immediately identify as being a huge problem. If you do, close it off. Close it off. It's going to be easier to be implementing a preventative measure than trying to deal with the consequences afterwards. Where people arrive for work, I'm not quite sure if there's a clocking in system that you have, but if you do, you need to think about measures to reduce contact. So biometric devices like your fingerprint scanners, etc., are immediately high risk. We've been given guidelines in respect of what to do. So if you do have a biometric device, you're either going to have to not use it at all, or you're going to have to look at sanitizing it after each person uses it. How about the entrance area? You know, when people are waiting to come into work. Generally, you know, before you would stand waiting for the offices to open, have a chat. Some people would have a smoke. And then as soon as the door opens, you know, people pile in. Can't do that anymore. There has to be a controlled environment. And one of the big things that we're going to have to really bring in and get the message across loud and clear, no touching. No touching when greeting, no hugs, no handshakes. All of that is now out. You're going to have to implement access screening. Now, what this means, first of all, is that you need to make it very clear to staff, and they need to understand that anybody who presents any of the COVID-19 symptoms or anybody who has been in close contact with somebody who has COVID-19. Now that close contact is within 1 meter. Need to stay at home. These people are a high risk. Now, when these people stay at home, there are certain provisions that apply in respect of leave. As I said before, COVID is an occupational hazard. So, rather than exposing everybody to this hazard, use your leave. If leave provisions have been exhausted, then people can be put onto unpaid leave. There are measures that can be implemented from the COVID Act, where people can be paid if they are self-quarantined or if they are staying at home because they're ill. Coming back to screening. So when people enter the workplace, your staff, you need to have a register, because you are going to have to control that every person who comes in checks themselves for any symptoms, confirms that they don't have any. You can introduce temperature screening. Anybody who has a temperature of 37.5 degrees or more should not be permitted entry. And you need to ask your staff whether they have had contact with somebody who is COVID positive. If you keep a register when staff arrive, you've got full records of this having been done, because you're going to have to produce it at some or other stage. Everybody coming into the workplace must wear a face mask. Everybody coming into the workplace must sanitize their hands or wash their hands with soap and water for 20 seconds. Now, you're going to have procedures for the hand sanitizing and for hand washing, and you're also going to have to provide facilities for this. So what happens if somebody does present a symptom? What happens if somebody's temperature is 37.5? Well, you're going to have a procedure to deal with this. If it's a customer, you don't allow them in. Quite simple. And you should advise them to go for testing. If it's a staff member, there are other things which need to happen. For example, if they're already in the workplace, you're going to have to isolate them. You're going to have to get them to a testing center. So you're going to need procedures so that everybody knows what to do should this happen. So once people are in the workplace, how do you keep them apart? How do you maintain this 1.5 to 2 meters distance? There's a number of ways that you can do this. First of all, you can look at physical barriers. Now, a physical barrier could be just about anything. There is no specification. It could be plastic which has been hung from chains from the roof. It could be something, like in the picture, where it's a perspex shield. If you've got open offices, there could be desk dividers. The desks themselves could be moved apart. They could be staggered. Your seating arrangement, you're going to have to think about how far your sales reps are from your clients. Do you need to move that a bit further? Do you need to perhaps implement tape to keep that distance? There's a number of not expensive, practical ways of keeping the distance. All of this is part of that planning. This is where you need to see, right, what's the best way that I can allow people in, conduct my business, but still keep them safe? I've told you already that everybody who's going to be coming in must wear face masks. Now, it's very important that your staff understand that they have to wear their face mask at all times. Because it's personal protective equipment in terms of the Occupational Health and Safety Act, you as an employer need to supply free face masks to each of your staff members. If there are less than 10 staff members, okay, it's a face covering or a face mask. My suggestion is think about it from a risk perspective. Face coverings don't always do the job. Rather be preventative. And as I said before, think about this as a long-term solution, not a short-term solution, and get the right equipment. Now, how many masks, when they need to be replaced, will depend on what the person's occupation is. What's the risk of the mask getting damaged, getting wet, etc.? I can't think of that much in the normal work environment, but you know, maybe for somebody who regularly cleans, it's a different story. You're going to have to train each and every staff member on how to properly use their mask. I've walked around, I don't know how many places, and I've seen people wearing masks that are not put on properly. Their noses are sticking out. When they talk, they actually move the mask away from their mouth, which is the worst possible thing that they could do. They remove masks when they're sneezing. All of this is a definite no-no. So you're going to have to train everybody on mask protocol. They also need to know how to care for the masks. So in other words, when you go home, don't just hang your mask up every day, put it on the next day and come back to work again. Those masks need washing, they need cleaning, they need ironing. There's certain temperatures that need to be applied to kill any viruses or germs. The purpose of the mask is twofold. Number one, if somebody is sick, that it prevents the germs, etc., from spreading, or the virus from spreading. And number two, it's a barrier if somebody should sneeze or should cough, etc., and droplets go and settle on a workplace and one of your staff members touching it. It's a barrier to prevent them from touching their own mouth and nose. So it protects the staff member and it protects the general public. Coughing and sneezing etiquette must be implemented. If anybody is going to cough or sneeze, we know, cover your face, use a flexed arm. But you need to think about practical things now as well. Are you going to provide tissues for your staff? Are you going to provide tissues for customers? If you do, the minute that somebody coughs or sneezes into a tissue, where is that tissue going to go? Doesn't help much if it gets left lying on a desk. It would have to go into some sort of safe or secure environment. So you're going to have to think about bins. Are you going to put plastic bags in bins? Are your bins going to be sealed? Once again, one of these things that you need to consider when you're doing your risk assessment. You also need to train people that when they have coughed, when they have sneezed, they need to wash and sanitize their hands. Now, people do wash their hands. They do sanitize their hands, but they don't always do it properly. As an employer, you have a responsibility to make sure that your staff know what they need to do in terms of any health and safety measures. So you're going to have to train them on how to properly wash and sanitize hands. Remember that if you're going to use sanitizer, and this is now for any customer who might be coming in to get a loan, make sure that you order enough and make sure that it's got at least 70% alcohol in it. Where your agents are sitting across from clients at a desk, you're going to have to produce and provide sanitizer on a table so that a customer can use the sanitizer as well as the staff member. Now, little things that people don't often know. When do you need to sanitize or wash your hands? Before and after using public transport or company transport. Before you come into the workplace, at the workplace, regularly. Between each interaction with a member of the public, Okay, before and after you put on your face masks or any other personal protective equipment. This is a big one. After contact with any frequently touched surface. So this is door frames, keyboards, screens, cell phones, door handles, cutlery, crockery. After using cell phones, after working with personal items such as a handbag, before and after smoking. Now, I've put this in because the sale of cigarettes at the moment is prohibited. The regulation does not say that smoking is prohibited, but we seriously recommend that you do not permit smoking in the workplace because it is a hazard, it is a risk, and it is one of the ways that the virus can be transmitted. You need to wash or sanitize your hands after blowing your nose, using the restroom, before eating or preparing food, with contacts with any animals or pets, and if they're dirty. As I said, you need a procedure to properly wash. The sanitizer must be at least 70%, and make sure that staff and customers are aware of what should be done when. Let's talk a little bit about meetings and training and sitting across from clients. What do you need to do to make sure that everybody is safe? Number one, keep a safe distance. Those were those physical measures that I was talking about. The barriers, the tape, the screens, and of course, the face masks. Now, as an employer, we have an obligation in terms of health and safety. First of all, if we identify a hazard or a risk, to remove it. Using PPE, or personal protective equipment like a face mask, for example, should be the last resort, not the first resort. It must be very clear that there must be no touching. Stationery. If there is going to be the use of stationery, somebody needs to use a pen to sign. That stationery is being touched. It would need to be sanitized in between each use. So it's very important that that sanitizer is there. Make sure that customers are aware that they need to use the sanitizer and how to follow the coughing and sneezing etiquette. Let's talk a little bit about public transport as well. It's one of the risks to your business, even though you might not actually consider it as such. When your staff now start coming back to work, a lot of them are going to be using public transport. Now, there are rules and regulations for taxis and buses, etc., in respect of occupancy levels, but your staff, and maybe you don't know what those are. So part of this back to work plan should be educating your staff on the safety measures that they need to follow when they use public transport. You know, climbing into a taxi is probably one of the worst risks that your staff are exposed to in their day-to-day coming and going, whether it be for work purposes or just going out shopping. You've got all of these people sitting in one small environment, often with closed windows. You don't know who's been there before, and much as there is a requirement for taxi operators, bus operators, etc., to sanitize and to clean their vehicles in between uses, doesn't always happen. Now, if one of your staff members now goes and climbs into a contaminated taxi and they don't know what measures to follow, they could easily be bringing this into your workplace. They need to know 70% occupancy level. If they can, try and sit at the back, open windows, don't touch anything. Don't let anybody else handle any of their luggage for them or help them with a packet, for example. So this type of educational process needs to be implemented. Think about any situations where there are going to be high touch areas or objects.
Dawn, I'm sorry to interrupt. We need to move up a little bit. We've done an hour, and people are going to leave.
Sorry.
The meeting, so you don't mind if I rush you a bit.
All right. Okay, I'm just going to go very quickly there. All right. Shared facilities, as I said before, think of the high-touch areas, implement measures to make sure that they're sanitized properly, that they're cleaned properly, that social distancing happens. You could stagger break times. Staff mustn't eat, drink, or smoke in the workplace. They must use designated areas, wash their hands, and as I said, eating utensils must not be shared. Knives and forks, cups, mugs, etc. If they get cleaned, must get cleaned properly, must get sanitized properly. You're going to have a cleaning program, and your cleaners are going to have to be trained in the program because they might be dealing with hazardous chemicals. Look at areas where people are going to be more often, where there's going to be high traffic. You're going to have to regularly sanitize that. I'm almost done, I'm sorry. Right, your procedures that you're going to need, there's going to be a whole lot that are going to have to be included in the workplace plan. For example, what to do if a staff member presents symptoms, what to do if there is a COVID positive case, what to do if somebody is in contact with a COVID positive person, cleaning up after a COVID instance in the workplace. And then finally, and I think probably one of the most important things is that there must be proper training. There's a whole lot of things that need to be trained in terms of the regulation. And all of them are relating to safety. Now, training can be done and should be done before anybody gets back to work. So we recommend do an induction program, which must be thorough, but then keep it going. Now, you can reinforce the message using posters, using email. There are free videos available, but you must make sure that it's not a case of everybody goes in, they're gung-ho, and after a week, everybody's forgotten what they're supposed to do. Right, I've tried to keep it very short and sweet.
No, brilliant.
I'm sorry, there's
Dawn,
just such a lot of information, yes.
No. Go back, please, just to the slide. It's 2 slides back, please, on what do you do if you have somebody in the space. I think that's very important. Just go back if you can.
Okay. Yep, let's just see. Hang on, I'm just going to stop sharing a minute. Okay, let's just put this up there. Okay. Sorry, I'm just trying to find the sharing. I moved everything off.
I think it was the next one, where when you actually find somebody in the workplace. Yes. Can you just talk us, I rushed you, and my apology for that, but it was just, can you just talk us through these things again so that people know what to do, what the contact numbers, etc., just practically?
Yes, certainly. So I spoke briefly about what to do if somebody presents symptoms, before they actually come into the workplace. If they do, you make a note of it. If it's a customer, that you don't let them in. If it's a staff member and they're presenting symptoms, send them home and get them to monitor themselves. They should stay home, and you need to decide for what period. If the symptoms are severe or if they start getting worse after 2 or 3 days, the person must go for testing. If the symptoms just disappear after a day or 2, let's say the person had a runny nose, etc., They should monitor themselves for an extra day or two and then come back to the workplace. But the minute that they come back to the workplace, you need to implement additional measures to make sure that the safety measures are complied with. Now, one of the things that you could look at there, for example, is instead of having the person use their normal cloth face mask, they actually use a proper surgical mask. They might need to sanitize their hands a little more regularly. They would need to stay away from clients if possible, or stay a little bit further back. You might, increase the distance to 2 meters instead of 1.5 meters. If there is a COVID-19 positive case at the workplace, there's quite a procedure that needs to be followed. I will quite happily provide you with a written procedure which covers all of this. But in essence, first and foremost, the person needs to be isolated. They need to be taken to a place where they are not going to have contact with a member of the public or any other staff member. They need to be provided with a surgical mask. So you're going to have a surgical mask available as part of your first aid kit, for example. They're then going to have to be sent for testing. Now, the testing, you're going to have to once again determine what these. This is the COVID positive person. Okay, sorry. They're going to have to be removed from the workplace, and then you're going to have to decide: are you going to shut down your workplace? Yes or no. Somebody is going to have to make that decision, that call. Let's say you decide to keep the workplace open, but you've now identified that one of your staff members, was COVID positive. You're going to have to go and see, was there anybody who was in close contact with that particular person? Now, close contact, as I mentioned before, was within 1 meter. If the answer is yes, the next question you're going to have to ask is, was everybody wearing their PPE properly? Was there perhaps a sneeze or a cough? Or what was the risk of anybody else being infected? If you identify that there was a possible risk, whoever was in contact with that person will have to be monitored. They will have to go home. They will have to self-screen. If they present symptoms, etc., you would have to then deal with it in terms of the procedure on presenting symptoms. You're going to have to notify the authorities. Now, the Department of Health, Department of Labor would all need to be notified. And right in the beginning of the presentation, I actually did put the hotline number. If you get stuck and you don't know what to do, phone the hotline. They're very prepared to give you guidance. They will tell you if you need to keep the person there. They will tell you, if you have concerns about keeping your workplace open. Talk to them. They're actually very, very good. I have spoken to them on 1 or 2 occasions already. Henny, it's difficult to discuss the procedure in a very short period of time.
Good.
I think that maybe what we can do is, give you this particular procedure for your members, so that this at least is one of the things that they know exactly what needs to happen in the event of an exposure. The last thing that you want is a positive case. Yes, a positive case happening, in one of the workplaces. Your customers are going to shun you. Nobody's going to know what to do. There's going to be chaos, and it's going to affect the business. If you've got structured procedures and everybody knows what to do, work can to a certain extent continue as per the new normal. So it is really, really important that that everybody knows what to do. I can, hold on a second, let me just stop sharing here. Give me 1 second and I'll show you what we're looking at.
Yep. There you are.
Okay.
To each person who is COVID-19 positive at the workplace procedure.
Yes.
Okay.
So this is what we're looking
briefly
at. Yes. Okay. So really, we've said there, okay, if somebody is COVID positive at home, they can't come to work. This is where we were talking about the reporting. So if you have an internal procedure, let's say one of your staff members now identifies that they are COVID-19, who will they need to tell? Who's going to be the contact person? You will need to identify, is it their manager? How are they going to notify? The Department of Health and the Department of Employment and Labour, I've already mentioned, must be notified so that contact can happen within 24 hours. Put the number there so that if it does happen, everybody knows who they should be calling. Okay. The investigation, as I said, will need to happen as to where the person contacted the virus. Was it in the workplace or not? It's very, very difficult. But generally what will happen is the Department of Health will be part of that investigation. Yeah, and then really, you're going to have to take guidance from the Department of Health to see, you know, whether you would have to close the workplace or not. In a lot of instances, it doesn't happen, but this would also have to be in alignment with your own workplace risk plan. So it's going to vary from situation to situation.
Okay, Dawn, that's great. And looking at the numbers people actually sat through and they've listened in detail, just share your contact details again, please. If you, no, it's possible, fairly easily, so we can do that. And then we will see if there's questions. I think most of the questions, while Dawn's getting that ready, questions around will we share? Yes, we will share the presentation. That's absolutely the idea, to everybody as wide as possible. Sorry, people are asking me to do things, yeah. We certainly want to share it. We want to share the information. It's really a national interest. But at the end of the day, guys, it's also about your personal health, your staff's health, and really about our economy. So just maybe if you may recall from the previous situation where we did a YouTube, we said it's a social disease with a high economic impact, as opposed to, let's say, somebody developing cancer in his own right. It's disastrous in his life, but it doesn't spread in the way this one works, and the economy is impacted in a very different way. So we find ourselves here that we need to do business, we need to be safe. You also want your safe environment to be a friendly environment, and you want it to be efficient. And it's a totally new way of working. So there was questions coming in. I think you've got Dawn's detail now. If you wish to further engage with her, simply comply.co.za. Jan, is there any questions which we need to share? You can remove that share screen now, please, Dawn. Jan, is there any questions? Are they in themes? I've been following the questions, but I don't.
Yes, there's a question or two. The one question is about the identification. I think Dawn referred to the identity document, and there was a question whether your driver's license would be sufficient. And following question is on, Sandra also mentioned shoes, and probably put that to Dawn as well, whether when you sanitize your hands, should the employer also sanitize shoes? And then a third question, maybe for myself, I always think of compliance as something you need to show, and undoubtedly our members will be inspected for compliance. And my question, because I think when inspectors come in, so an official comes in to inspect you, I think it would be prudent to put them through the same process when they enter your shop. So don't make the mistake of an official coming in to inspect you and you disregard your protocols. But maybe Dawn can say something about that.
Thanks, Dawn.
Okay, all right. Let's answer the questions as I recall them. I think the first question was about an ID and does a driver's license suffice? The answer there is yes. So your usual forms of identification would suffice. The second question was about whether you sanitize your hands. Do you need to sanitize your shoes as well? Not necessarily. The reason why there's a requirement for people to sanitize their hands is because generally you touch things with your hands and then you might be touching a surface where there, somebody sneezed, there might be droplets with the virus on that particular surface, and then you go and touch your own face as well. So this is one of the ways that the viruses can be transmitted. So I think your shoes should be okay. Right, the third aspect that was mentioned was showing compliance. Now, I think this is probably one of the most important questions that I've heard yet, because you show compliance in two ways. Yes, having an inspection can be quite intimidating at sometimes, and it's very, very important that it doesn't matter who comes into the workplace goes through exactly the same protocol. I'm 100% in agreement with that. I also think that in terms of showing compliance, it's a training exercise. So if you have posters up showing the dangers of the virus, showing how to sanitize, etc., it's not only showing compliance, but it's also enhancing the message across to clients and to customers in terms of what should be done. Because we all know, if you give a message across once, people will remember it for a short space of time, and then it just gets forgotten in the day-to-day operations. You should have a pack, a kit, a workplace plan you have to have, a health and safety risk assessment you're going to have. You're going to have your procedures. You're going to have to show that training has happened. In one work area, we had videos that were being played, etc. But I think the second part of showing compliance, and perhaps the most important part of showing compliance, is keeping everybody safe. It's not going to be 100% guarantee that if everybody follows procedure that you're not going to get affected. But if you have the know-how and the procedures on what to do if something does go wrong and you handle it properly, you're going to limit the damage. And I think that's the critical thing that we need to focus on now, is damage control.
Great, thanks, Dawn. Any more questions? Jan, I need to wrap up and I want to make one or two
I think
comments.
you can wrap up, Benny. I think we've dealt with all the questions.
Thank you very much. So, members, just a couple of comments from my side. The one thing I find encouraging in the presentation, Dawn, and thank you, Dawn, you took us through a lot in quite a short time, is that you can build it fit for purpose for your environment. So it's not that they're trying to treat you like a bank or a massive organization. It allows for that flexibility. It allows for innovation. And I think we're in the game of risk. Our businesses are about risk. And we understand risk, and we understand the consequences of being not prudent when we have to handle risk. So, as it is really a risk management exercise in extreme, I think the challenge lies in to engage with consumers in the way they now want to engage with. They want to engage in a different fashion. And it's really an opportunity, whether you're small or big, to position yourself as a business that really cares about your staff, cares about your environment, and cares about your consumers and your customers, and also show a degree of innovation. So I want to go back to my experience this weekend, where I literally changed shop for the weekly groceries, because shop B just did it better and safer and more efficient and in a friendly in a friendly fashion. Still, I wouldn't prefer not to wear a mask, but I have no choice in the matter. So I really want to encourage members to go the extra mile, do the smart things, do the right things, and then certainly also share with us your feedback. If you have experiences of things which work, let's share that. I don't think we must have trade secrets when it comes to a matter of this nature. So we're very happy to share. And that then is also to confirm, we have recorded all of this. All of this will go on into a YouTube video, and there will also be links in our website. And please share it as far as you possibly can. So I don't know if anybody would like to add anything else. Dawn, any further comments you would like to make in closure? And then I would like to close the Zoom webinar.
No, Henny, I'm all done. Thanks. As you said, lots of information in a very short space of time.
Wonderful. So massive amount of information to assimilate, guys. Please take it serious. Apply your mind to it. There are requirements for sectors to come with sector plans. I'm not sure how it's going to work out for us. And thank you very much for what you shared on the chat, and some very good information there as well. So thank you everyone, and be safe, be alert,